Welcome back, everybody. You are on the Educated Retirement Show with your host, Jay Kaplan. And this is the section that we try to bring the best guests possible for the, well, I could say aging population, but I think it's also important for their children, for people who are looking at trying to age, because isn't that what we want to do? We want to get older. Anyway, we're back after we had an unexpected break in continuity, and we don't know whether it was caused by sunspots or aliens. I prefer aliens, but we're back now. So what I was saying was, I think I was talking about the friend of mine when we got together on Wednesday with Dr. Arash, that a friend of mine, his wife was given 4 to 6 weeks to live, and that was 32 years ago. And she's still doing very well. So, that all has to do with hospice. Is not a dirty word. So let's get right back to Dr. Arash, and we'll let him introduce himself and then introduce his associate. Go ahead, take it away.
All right. Hi, Jay. Pleasure seeing you again. My name is Dr. Arash. I'm one of the doctors and the chief operating officer at Golden Years Hospice Care. What we do is try to manage patient satisfaction, make sure everybody's on track, and really address our patients' needs. That's what my goal is. And today with me, I have one of our lovely nurses. She's in charge of watching over the other nurses as well to make sure everything is going smoothly, because it takes more than one person to run a village.
Yes, it does. Let alone running the world. But you guys are close to that level. So go ahead. Would you like, what's the, the head nurse, we'll call her. What is her name and that kind of thing, and then I'll leave it up to you, Dr. Arash, who's going to do some talking.
We'll both talk, but I'll let her introduce herself, and then we'll both talk.
Hi, Mr. J. My name is Mildred Castro, and I'm one of the nurses here at Golden Years.
I think you're the big cheese nurse, are you not? You're ahead of the other nurses, right? Or to make sure that everything is running as smoothly as Dr. Arash wants them to, correct?
Well, I'm not sure, but I wanted to, make sure that I follow orders with Dr. Arash, yes.
Yeah.
Make sure all our patients are well taken care of, manage it.
And I'm sure they are. So did you want to get into a little deeper into what you do, maybe on a daily basis or what that kind of thing?
Well, I think that might be just too much for your radio listeners, just for them to say, well, she checks in on patients. But the whole purpose is I actually wanted to bring her is for you to see that it's not just one person that cares about patient management. When we talk about supportive care and what hospice means and palliative care means, it's literally a team. Yeah. So I don't want someone to think, well, it just means I'm going to get to see a nurse or I just get to talk with a doctor. Mm-hmm. There's actually more. There's a social worker, there's a pastor, there's bereavement counseling, there's a home health aide. There's so many people. There's volunteers that can come out and help you if they need to for you, or help you with cooking or something, or anything to help the family. The whole point goes back again that when people are in need and they need that supportive care, it's not just one person. So when they come to us, I want them to know it's not like I'm asking for a doctor's help. They're getting more than what they would think they would be getting. They'll have the nurse come and visit them, and we'll try to find out what they need. And part of all this is really partnering with everybody else. Is like if we need to connect them with a lawyer to make their final estate planning. If they need help with a mortuary to make the final preparations, to really help them step by step and say, like, during this time, you should by this point of time, you should have these taken care of, making sure your
Right.
kids are taken care of.
Right.
If you need extra money, there's reverse mortgage. If you need this,
Thank you.
yeah, there's all these things that you need to do or we can do. If you need a caregiver, like for 24 hours a day, you need someone to be with you. We've partnered with One Heart. We can, connect you with them and really get you good prices and good deals and really incorporate all our services together.
Yeah, good prices is important. And because, there's a lot of elder abuse out there, which we talked about on Wednesday. And I know, I'm supposed to have seen a lot of that doing reverse mortgages, but I just do not, which makes me very happy. And, we need to make sure that everything is on the up and up. And I think it is misnomer the right word, but I think people have the wrong idea. A lot of people, I being one of them, that a hospice was a separate place. And I'm sure there are some hospice, facilities here and there, but really you are at their home and
Right.
they are where they are comfortable and where they're going to learn to fight to stay alive with you guys helping them to do just that.
Right. So traditionally, you were right. Back in the days, hospice was a place where people would go for, end of care treatment and support. Nowadays, with our medical system has changed and people have realized that people want to be surrounded by their loved ones. And right now, even with COVID-19, nobody really wants to be stuck in a hospital and increase the risk of not being able to see their loved ones. All of this plays a role that hospice care has moved into a patient's house where everything comes to them. They don't have to feel like they're being alienated. Nobody has to be separated. Family can come and visit them anytime they want. And that's kind of the whole thing, is to make sure people are comfortable, they have their loved ones and support system with them. That's why we really emphasize the supportive care, the supportive team, because if you traditionally are sick and you go to the hospital, you're not going to have your loved ones around you, especially now because it's
Right.
COVID-19. They're like,
Mhm.
stay away. You have a high risk of getting infected. There's a lot of COVID patients, and we don't want that. We were trying to keep everybody safe, and we're trying to bring comfort to the patient at their home, where they're comfortable in their own bed, their own blanket, their own pillow. They have anything. They have their pets if there's pets around, because they can't
Right.
have them at the hospital. They can have the grandchildren visit. They can do all the video chatting they want, listen to music as loud as they want,
There you go.
watch movies. It's just about being there in a comfortable place. I mean, you want their last memories to be, if it comes to that time, something memorable, not something like I'm being tortured at a hospital.
Yeah. And it's so important then, maybe you've gone to bed thinking about the worst possible case. But when you wake up in the morning, you're there surrounded by your own family, grandchildren, your own belongings, your own hobbies, your own everything. So you got to wake up in a good mood. I mean,
Right.
that's what the whole thing is, just to be positive, right? Up to if there's an end, and there isn't always. Well, there is always, but other than you two and me, we're going to live to 150. But in reverse mortgages, it is the law that you have to pay off your loan when you reach 150. So I wonder how soon they're going to have to change that law. But we are living longer and longer, and one of the reasons we are is because of people like yourselves.
Right. And that's kind of like how we're trying to help people. It's a lot of people get confused and scared, and especially like people who have cancer and they're like, I don't know what to do. I can't deal with this by myself. They go to the doctor's appointment and not realize, if going through chemotherapy, going through all this stuff, yes, it makes you really sick. It makes you have the will that you don't want to live anymore. It's not easy. But with us, you'll have a team. You'll have the nurses come and check on you, make sure you're okay. You'll have the doctors make sure you're okay. And all of that is really part of our palliative care. You have to have the will to want to get treatment and survive. And that's the reason we're calling it palliative care. We want you to understand this is not a place where you go to die, it's a place where you get support to move forward, to live.
That's great, and that's the way I look at it now. And we want more and more people to actually look at that. Now, palliative care is a word, me being kind of from the backwoods, I really hadn't heard before. You want to explain that a little bit more?
Palliative care is really, it's a kind of care that gives support for people who are not doing well. The really best direct answer is really thinking about someone who has cancer, going through chemotherapy, radiation. They feel weak, their immune system is shot from all this stuff, they're getting sick all the time. Instead of just burdening and going to the hospital and saying, hey, I'm sick, and going through the hospital and having the potential to get sick again and again, or not having an appointment to see the doctor, or sometimes they feel weak and not really want to leave the home. Why not have a nurse come and visit you? Why not have like a doctor visit you or be able to call them? Why not have all your medications and supplies come to you directly? Why would you have to worry and leave your home when you're feeling sick and not there? So that's kind of what we're trying to do. That's the palliative aspect of the care that we provide. It's really telling you that it's a care support system built into for patients that need help.
That's nice. Care support. And speaking of that, let's take a little minute here to tell everyone how they can get a hold of you, because let me preface that by saying you don't want to wait until you need palliative care or worse or whatever. You don't want to wait and then start shopping around for your mother, your father, your loved ones, or, even for yourself. You want to know in advance who you're going to call on. Who you're going to call. It's going to be, the people who you have pre-interviewed, you have a rapport already set up. And if you never need to call them, that's one thing. But, I think most people, if they're going to live long enough, they are going to have to call people for in-home care, palliative care, hospice care. It's just as important as having a doctor's name and phone number. You need to call now so you'll have it when you need it. So go ahead, please, and give your contact information.
So you can reach us at 1-877 740 0807, 1-877 740-0807. You can always find us on Google at goldenyearshospice.com. You can read about us. You can email us from there. You can call us. We'll reach out to you. There's always, you can even email us if you want us to send you more information, like a brochure or anything directly. That's info@goldenyearshospice.com. So everything will be on our website anyways at goldenyearshospice.com. Golden Years, it has a S, hospice.com.
That's right. It's not just you got more than a year, you got years. And that's part of the positive forward thinking that these people have. So, you need to call them. You need to get brought up to date. And you guys are expanding, correct?
Right.
Quite a bit.
So we're expanding. We have nurses all over California. We're all the way from San Diego all the way till San Francisco. We have a whole bunch of nurses in the Orange County, Irvine area. We're working with hospitals directly to make sure that they know that who we are. We're also working with nursing homes in the areas to make sure that they understand, like once they need that extra help and they get discharged from the nursing homes, where they can go. And the whole point again is to work with everybody within the community. And it's about connecting everyone and letting them know it's not just, having a nurse or a doctor. It's more to that. How else can we help you? What else? There's a social worker, there's a pastor, there's volunteers. There's so much more than just saying, like, I'm just calling for help. Like, you're getting more than that.
Yeah, and the reason you are is because you're forward thinking, you're positive, and people who are positive are probably going to live a little bit longer or maybe a whole lot longer. So it's so important to have people like you around. And you go to the people's home, people are comfortable where they are, and that helps give them more more of an optimistic view of the future, which is what we all need.
Well, there's a joke basically. If you have a problem, just call me and I can solve it for you. That's basically my responsibility.
Well, I got a long list. When should I start calling? I mean, you cover all subjects, correct?
Yeah. So if you make an appointment, call me and then we'll cover all your problems.
All right, now you're talking. And go ahead, please.
People have issues. There's always problems and concerns, and I want them to feel comfortable to be able to call us and know that, if they want to talk to a nurse, they don't have to talk to a doctor. You can directly talk to a nurse without any problems. If you have any issues or concerns and you say, well, I want to talk to a doctor, that's not a problem. If you need, extra help, like if you need caregivers and all that stuff, that's not a problem. You can call us and say, I need extra help. I need someone there 24 hours a day. I need this supply. I need this medication. We are connected to the pharmacy, so we have a direct line to the pharmacy that the medications will come directly to your home. So you don't even have to worry about seeing a doctor and saying, well, I need to see a doctor because I have an infection. You don't need that. You just call us and say, well, I have an infection. We'll ask you a couple of questions. We can even order labs for you. They'll come to your home, run some labs, and then everything will be done for you. Your medication will be delivered to your home.
Wow, that's great.
Concierge service.
That's great.
Yeah.
It's almost unbelievable, but it's really great that you offer that. And things like chemo, not to mention radiation, sometimes 20, 30 years after you get the radiation, you get problems. So people who are sick, let's say they have cancer, they may, we won't say uncurable because you never know in a lot of cases, but when they're suffering already and they have like chemo, they're suffering even worse. And they get that mixed up with the underlying issue and think that they're really in much more trouble, I would think anyway, than they already are. And you guys help them through that and help them realize that, what you're feeling now is the chemo, not the underlying disease particularly.
Right. And that's kind of like how we're trying to work and make sure people understand that it's not really a place where you say, I'm going to die. It's more for the supportive care.
Right.
And the best part about all of this is a lot of people think, well, all this sounds wonderful. How much is it going to cost me?
I was going to get into costs about not only your services, but other services you have contacts with.
Right.
So, yeah, let's speak to that. Go ahead, please.
So for cost, if you're 65 and older, Medicare covers that. If you're 65 and younger, it all depends on your insurance. Medi-Cal covered California covers all of these expenses. But it really, we work with a lot of people, try to see how much help we can give them. Most people don't even have to worry about it because they're over 65 when they reach to have a certain amount of problems, and that's where Medicare really covers it and they don't have to worry about a penny.
Yeah, I wish I remembered that far back when I was 65, but yeah, I understand. And I had some problems this last year, but so far, knock on wood, I've come through all of that in pretty good shape, even though a lot skinnier than I used to be. But you also have some connections with other things like mortuaries and other services. And again, most of us don't want to talk about that, but guess what? You have to. And the sooner you get it out of the way, the better. Then you don't have to worry about, well, am I going to go visit grave sites for myself next week? Get it done with. Get it out of the way. That'll probably help you, that is the patient or the individual, whether you're sick or not, get it out of the way. And I believe, Dr. Arash, that you have some connections there, price-wise.
Right, and that's part of really working with the community. We worked with a funeral home mortuary that offers an extreme discount for our patients. Typical funeral cost up to $9,000-$10,000.
Oh yeah, that's true. It's crazy.
We found one that's willing to do it for 1,800. So these are really good discounted prices for our clients. And the whole point is I want people to think we're not here for the money, or it's more about helping the patients.
Right.
That's why I partnered up with these different companies, is to give people a chance of, fighting chance, and tell them, I understand that you need these, but these are like the best prices that I can get for you.
Right.
I picked out these contracts for you. I know where I'm sending them. I trust them. So even for, if you say, like, do you trust these people? I can say yes, because I've worked with them. They're not some person that I'm just referring to you because of Google. It's because I built that strong relationship with them, and I understand that they will take good care of you. They represent who we are as much as I represent who they are.
Wow, good. And you don't want your loved ones, if you think you are going to pass, you don't want to have the burden on your loved ones. And if you don't go ahead and pass, that's good too. It's all taken care of. But, you don't want your loved ones or those that you leave behind to have to spend more money than they need to for what you actually want. Whether that's a nice grave site where other family is, or whether you want a parade in New Orleans with all kinds of jazz players, all of that's probably available, right?
Right. That's the whole plan, is to make sure everybody is aware of what's going to happen and basically solve all the problems, like whatever they need. If they need extra money, if they need extra caregiving services, if they need extra support. And that's, that's what I said from the beginning. We're here to solve their problems, not to anyone's problem.
You said if they have these needs. I think everybody has these needs. No matter how rich or poor you are financially, you have those needs. Some of them may or may not be financial. Emotional covers everybody, absolutely everybody. And in this world, of course, the financial and the emotional kind of get hooked together anyway when it comes to family. But, that's why I say that these folks at Golden Years, they taught me that hospice is not a dirty word. Why? Because I was ignorant of the real facts. And I don't want any of our listeners to stay ignorant of the real facts. And look how good it is to speak with these people. And that's the way it's going to be. That's the way it's going to be when you call them up. Now, we only have 1 minute, believe it or not. I'd ask you to stay on longer, but I know you're coming back next month again, and you're all welcome. Go ahead and give out in our last 30 seconds or so, your contact information. And it's so good. Let me just preface by saying it's so good to see you again. Even though it's only been 2 days, it's so good to see you and to meet you also. So go ahead and give that phone number, email, and we will sign off.
It's 1-877-740-0807. 1-877-740-0807.
Great. And, again, it has been a pleasure speaking with you and listening to you folks. And I know it's a pleasure to everyone who's listening. So you guys, you take care of yourselves, because we all need you guys. selfishly, we need you guys, but I think you all have, families and other people that need you also. So let me just say thank you so much, both of you, and it was great meeting you. And we'll be together again soon. So take care of yourselves. Say hello to Mr. B.
I will.